Please go ahead, sir.
Shall I start?
Yes, sir.
Hello and welcome everyone. Welcome to this wonderful webinar, this program being organized by ASSOCHAM for benefit of all of us in this series of illness to wellness. And this is focused on management of diabetes during these troubled times. Diabetes management during COVID-19 era. So we are very lucky today, and we are actually honored to have such a star-studded panelist, and I would say a galaxy with us of diabetes specialists, renowned diabetes specialists from all over our country, who are going to give us, who are going to guide us, who are going to give their best advice, and who are going to allay all our fears on what is to be done and what is to be and what is best for our people, of our patients with diabetes. And I would like to add here, it is not just about diabetes, it is about everything in our lives. This, whatever we are going to discuss, concerns not just diabetics, but everyone, because what is advised in diabetes is basically a healthy lifestyle, and it can be accepted and it is useful for all and everyone. Here I would like to start with a shloka from the Atharvaveda. It is the voice of our Rishi Munis. It says, Pashyem Shardah Shatam, Jivem Shardah Shatam, Buddhyem Shardah Shatam, Rohem Shardah Shatam, Pushem Shardah Shatam, Bhavem Shardah Shatam, Bhuyem Shardah Shatam, Bhuyasi Shardah Shatam. In Hindi it would mean, हे सूर्य देव, हम 100 वर्ष देखें, 100 वर्ष जीवित रहें, 100 वर्ष तक ज्ञान प्राप्त करें, ज्ञान संपन्न रहें, 100 वर्ष तक निरंतर वृद्धि करें, 100 वर्ष तक परिपुष्ट रहें, 100 वर्ष तक संतान के प्रभाव से संपन्न रहें, 100 वर्ष से अधिक समय तक जीवित रहें. So these are all the things that we would like to, but not all possible, but this is our ultimate goal, to be healthy, to have a good life, to have a productive life. And unfortunately, in these troubled COVID times, things have come to a standstill, a lot of stress, and things are changing very fast. So over to Mr. Anil Rajput for beginning the session. Sir.
Thank you very much, Dr. Rajesh Sethi. It's my proud privilege to welcome this galaxy of people. Dr. Amrish Mithal, Padma Bhushan, Chairman and Head of Endocrinology and Diabetes Department, Max Healthcare. Dr. Anup Mishra, Padma Shri, Executive Chairman, Fortis Center of Excellence for Diabetes, Metabolic Diseases and Endocrinology. Dr. Hema Divakar, Medical Director, Divakar's Specialty Hospital. Dr. Kesri, Founder and Director, Total Care Control, distinguished guests and friends. Good morning to all of you. At the very outset, let me say that when you have Padma Bhushan and Padma Shri and other distinguished panelists available on the panel, there is frankly very little to be said, as there is so much more to hear from them. The wealth of experience that this set of luminaries bring to the table is immense, to say the least. The past 5 months have been indeed extremely nerve-wracking and difficult for mankind. The true extent of this COVID-19 pandemic, along with the unimaginable pain and suffering that it has unleashed, has created a sense of fear and paranoia. In addition, it has demotivated the economic, societal, and individual spirits of people across the world. What's worse is that the future too seems quite uncertain, as the makeup of this adversary is far from too complicated than we previously anticipated. Today, the total number of people afflicted by this virus is upward of 21 million, with over 2.5 million of those in India. It is an established fact that people who are over 60 have high blood pressure, diabetes, and other comorbidities are more vulnerable to this virus. To make matter worse, the effect of this virus of a wide spectrum from lungs to kidney and from the blood to the heart. In 2020, according to the International Diabetes Federation, 463 million people have diabetes in the world, with 88 million people in Southeast Asia region. And out of this 88 million, 77 million are in India. Therefore, 1 in 6 people with diabetes in the world is from India. This in itself is a very serious problem. And with the addition of COVID-19, it has become an explosive and extremely challenging situation. One that is pushing doctors and researchers to their absolute limit. I actually will not get into the details as we have the best of the best to dwell into and discuss the subject of diabetes management during COVID-19 times. We look forward to their advice, suggestions, and views about this issue at hand, along with the most practical and effective way ahead. This is bound to be enlightening, engaging discussion, and I wish this webinar my very best. Thank you and Jai Hind. Over to Dr. Rajneesh. Dr. Rajneesh.
Old patient.
What happened?
I think
We'll
you
just
can
start a discussion. Yeah.
asking some
Yeah.
one general question, and we can continue with the
We can start that discussion. Yeah. Mr. Rajput, you can ask a general question too. You know, there's so many.
Otherwise, I have list of questions. I can be a moderator. I'll ask everybody.
Yes.
नहीं राजेश जी शायद म्यूट है राजेश जी जस्ट राजेश
He's not
केसरी जी
visible.
just
Yeah, his slides are there now.
He is offline right now.
So I think let's start a little bit of
जी,
conversation.
yeah.
I
I
Yes.
can ask a very simple question.
Yes, sir.
Doctor, during this time, you must be finding that a lot of people are under a huge fear of going to work, even though they have a very controlled diabetes. So what is your view and advice to them, whether they should go and attend office during COVID-19 or stay away from work?
Amrish, you can start,
Okay.
and I have a list of questions which Dr. Kesari was supposed to ask.
Yeah.
I will ask a couple of questions after this particular question.
Sure. So it's a very practical and simple question: whether people with well-controlled diabetes, should they be going to work or not? Right? That's the basic question. So there is a all-pervasive fear of COVID, diabetes or no diabetes, and the fear in people with diabetes is greater because we know that they are at some greater risk. Now, the first point is, are people with diabetes at greater risk of acquiring COVID? So far, the data overall suggests that the risk of getting COVID in somebody with diabetes is not much higher, right? There's a difference between outcomes if you get COVID versus your actual risk of getting COVID. And this is particularly likely to be true of those who are well controlled. A poorly controlled diabetes is a different story, but a well controlled diabetic possibly is not at greater risk of contracting the infection than someone who's not a diabetic. Maybe there's a minor increase in risk, but it's not major. Having said that, the precautions that are observed, that need to be observed when you are going to work for anybody, but in particular if you're a diabetic, because we do know, and we'll discuss that in detail later, Dr. Mishra is here, that if you do get diabetes, if you do get COVID and you are a diabetic, then the outcomes can be pretty disturbing. So what should we do? I think we have to follow the basics. We are all getting confused about a million things. The basics are the following. Number one, we should all wear masks. It is a huge problem even now. Even in the morning, I go for, it's very irritating. And either you don't tell people or tell people what you do. People wear their masks around the neck. Masking is very important. Number one, if you're going to go to work, especially anytime you're outside your house, masking is important. Second is, if you have meetings in the office, try and have not more than, significant distances, not more than 4 or 5 people in a room, right? Thirdly, if you're doing that, don't have protracted one-to-one interactions with people. Like, don't go beyond 15 minutes with one person. And if there's just 2 of you in a room, make sure that you're maintaining a 6 feet distance. Even if one person has to stand, it doesn't matter. Standing is actually better. So what I'm saying is that as far as possible, if you have to go to office, you should work from home as much as possible. But if you have to go to office, which is inevitable, and the world has to restart and is restarting, you have to make sure you're wearing masks. Number one, you're at a distance from your colleagues. You're not in crowded spaces, in closed rooms. I'm doing OPD consultation with the room open, door open. I don't close the door anymore. So those are big changes for us, but that's how. And last point is the Formide transmission, which is less important than air transmission, but it is very much there. So at the same time, you need to be sure that you're not touching things unnecessarily. If you are doing that, you're sanitizing your hands, the table, the doorknobs, etc. And periodically actually use soap and water, which works the best, to wash your hands. If you're able to observe these precautions, and if it is important for you to go to work, I don't see any problem in doing that.
Thank you,
I just
Doctor.
wanted to say that if the pregnancy is also added on top of this, already the fear of routine pregnant women, going out anywhere, because they're considered as elders and children, they're also considered as at-risk group. But as Amrishji said, we've also found in the recent literature that just being pregnant does not make her more vulnerable to getting the COVID infection as such. So pregnancy is one thing, COVID fear is another thing. Diabetes in pregnancy is 7 times more common in Asian countries, especially India. So there's always a chance that 1 in 4 or 1 in 5 of our pregnant women may have diabetes also. So all these compounds to the complexity of the mental stress for sure, but most often than not, some of the women are anyhow not working at all. Some of those who are working from home if they're in a job placement which can allow them that. And the third category is a little bit more apprehensive because of how to reach the office, the issue of going in the public transport, etc. So there are many practical difficulties in actually reaching the workplace. And over there in the workplace, the policy and the culture is so crucial. If the leader of the workplace is not so much up to the infection prevention control, then the women who go there are in trouble. If everybody in the team takes it very casually, it really hits her heart. So overall, pregnancy, diabetes pregnancy and COVID scenario in the country has been challenging for us, the women's healthcare space, because so little is known about this. There is so much for us to take care of. So that is the scenario as far as women, pregnancy, diabetes, and COVID are concerned.
Thank you. Just let me add on to what Ambrish has said regarding mask. I think that is, having seen last 5 months and having seen the drug development and thousands of trials which have gone on, we are finding very few drugs which are really effective. And that too in a stage when the oxygen levels are falling down and the respirator is warranted. So masks are the only thing which is the truth, and the truth is mask. And there are three types of masks. Because there's a lot of confusion about the mask in the general public, and I will just demonstrate. This is the mask which is made of cloth. And I put it. There are two layers here, and these can be washed. But these have limited no capacity to block aerosol. Aerosol is something which is very thin and in the air and has been known to transmit. Virus is known. So you can wash this, you can wear it in the public place, but it will only stop possible droplets, bigger drop, something when you're speaking, bigger droplets, and that too not fully. So this is convenient, washable, reusable. The second mask is the usual mask, which we wear. This is the three-layered mask. And you see, I put it here, what is the problem is that I can put 4 fingers there and still it is open from the side. It is not a well-fitting mask. Now, if you wash it or heat it, it will be damaged. This doesn't have capacity to actually block any virus, and has a capacity to block around 50 to 60% of the droplet. So you can wear it in the public places again, like cloth mask, probably slightly better than cloth mask, but this is the usual mask, and this is not reusable many times, but you can use a couple of times and then throw it away. The best mask is this, which we all, Ambrish, Hema, everybody wears this. Now look at this. When I wear this mask here and put it here, I can't put my fingers here. I can't put my fingers anywhere. This is N95 mask. N95 means 95% of the particulate matter will not be transmitted. And it has capacity to block any virus, anything which is around 300 up to 300 micron. Now virus is smaller and it will block the virus. Unless you're wearing it something like this or something like this. So this is for health professionals. Now, if it has valve, it is bad, because valve is only for particulate matter. When you are in a polluted thing, it will prevent any particulate matter from coming in, and it will eject your breath out. So you are going to infect others. Remember, wearing your mask is less of your protection. The wearing of others' mask is more of your protection. Others don't wear mask, you're not protected. So these are three types of masks. You need not have this. You can have this, have proper wear it properly. There is no use of wearing it like this or you're wearing it. It has to cover the whole of this. And if you are using it and others are not using it, it is of no use. So please tell others to use it. So this is for clarification of mask. I hope Kesari has joined. Dr. Kesari has joined?
Yeah.
Yes, sir. I'm sorry for the technical problem that we were having. Can we start with a very small question? So are diabetics more likely to be infected with corona? Because this is something which is worrying everyone. If this has been answered while I was away, we can skip.
Has been answered.
Yes.
We can skip. Yeah.
So you can go on to, I think, 10th question or 11th question, which we have, because Ambrish has answered 7. I've answered 1, and him has answered 1.
Okay, what should a diabetic do when they get sick or if they have corona? Is there something special would you advise for them to do?
So maybe Ambrish can answer and I can fill in after that.
Sure. So I think there are all diabetics can't be dumped into one basket. A young, newly diagnosed or well-controlled, fit diabetic is not the same as an older diabetic with multiple comorbidities and poorer control. So by and large, if you're a well-controlled, otherwise fit diabetic, you're really not at too much of a risk for anything in terms of getting affected by COVID. However, you will observe the same protocol as others will. If on the other hand, you have multiple comorbidities and you have symptomatic COVID, you know that COVID could be mild, asymptomatic, mild, moderate, severe. If you're in the asymptomatic zone, by and large, you just need monitoring sitting at home. You need to quarantine at home or isolate at home, actually, right? If you are symptomatic mildly, you need to keep track of that. You need to be in touch with your doctor for sure. You may require tests that will tell us about the polymorphs and the lymphocytes. You may require, tests with inflammatory markers from time to time, but you can still manage with just staying at home and isolation. If you are heading towards moderate, or if you're in the mild zone and you're very vulnerable, like you're 75 years old and you have a kidney disease along with diabetes, uncontrolled blood pressure, heart disease, then it may be possible that you may prefer to get hospitalized. But otherwise, for diabetics, moderate COVID does mean hospitalization. Severe COVID is a different story altogether. In terms of precautions, the same precautions exercised more carefully, even more stringently. Carefully is not the correct word. More stringently are required. Yes, because diabetics are more prone. You know the things that we say. You have to keep track of your fever. You have to keep track of sudden reduction in appetite. You have to keep track of any breathing difficulty. Having a pulse oximeter is a big help. Any drop in oxygen is important. Drop in oxygen on walking is important. Breathlessness on normal household activities, all those are markers for you to contact your doctor immediately. In this, I would say contact with your physician is very, very important. And if you're trying to decide everything on your own, it's a big challenge. Medication does not have that much of a role. Suddenly in mild or asymptomatic patients, people are being pumped with a lot of medicine. Sometimes I see that there is very little proof of any medication having any major role at this stage. So the answer is yes, the same things as for people who don't have diabetes, but the threshold is lower. Like any slightest discomfort, you contact your doctor, go to the hospital. And sometimes even mildly affected patients who have multiple risk factors may want to go into the hospital.
My concern is more towards the fact that ignorance is bliss. There are many in the women's healthcare space that we see that they're not even diagnosed to be diabetes. There's a large section of our population of the women who may have had diabetes in pregnancy, never ever followed up, and suddenly it's just by chance that they get to know that they are diabetes. So my key to everybody who is watching this program is, after, because ethnically we are so very prone to it, your routine checkup for sugar levels is an absolute must, because you should know your status, because all the things that Dr. Amrish ji said applies to those who are already known diabetics, but there may be so many of you who are not even aware. So this is one a trigger point where you should assess and you should take the due cares that has been already mentioned.
So just one point before I go over to Anup, just one point, Anup, is that the other point that, and I'm sure will be discussed in detail later or whenever, is that glucose testing has to be very frequent during this period. Don't ever run away from diabetes. You just have to test, make a chart. When you talk to your doctor, I meant always with your glucose chart. Glucose testing, hydration, these are the two most important things. Don't chuck your medicines suddenly. We can discuss that in detail, but this is the principle, keeping track. Over to you, Anup.
Yeah, no, I'm just repeating. There are two types of people here. We are talking of diabetes and we are talking about non-diabetic people. Now, as far as diabetes, Amrish has said almost everything. But the last point is very, very important. Stick to your medication. Whatever you are taking, please don't leave your medication. And check your sugars frequently. And you should know that what should be the level of sugar which indicates good control. Because you're not going to go to the lab and get a hemoglobin A1C done and so on. So please avoid that and get your home sugar monitoring. And if needed, you please contact with your physician or diabetologist and using a teleconsult or something. So sugar management and the control is extremely important, because that itself will indicate, if you get COVID, what would be your state in the hospital, whether you're going to have a severe problem or you're going to have a mild problem. Just the level of sugar. And that applies to the non-diabetic people also. You know, many of the people who are non-diabetic are gaining weight during this time and inclined to become diabetic. And that's what Hema was saying. So that applies to the women also. So the non-diabetic people, if they have somebody in the family who has glucometer, please check your sugars also. And many of them will turn out to be diabetic. Now, what is the importance of blood sugar as far as the severity of COVID-19 is concerned? It is well recorded that patients who are uncontrolled diabetes have a very high mortality. They are at the highest spectrum of mortality. And those people who are non-diabetic but found to have slightly high sugar at the admission during COVID-19 also have high mortality. So look at this. That's why the diet and exercise not only applies for the patients with diabetes, but also patients who are non-diabetic, relatives who are likely to develop diabetes and who are overweight, who have gained weight, who have diet and exercise has gone for a toss during this time. So both kind of people need to control themselves. But diabetes is not the only one. As Amrish had said, it is other things also matter. So your weight matters, your blood pressure matters. And if you have a cardiac and renal condition, that also matters. But what is in your hand? In your hand is your weight, your diet, your exercise, checking your blood sugar, and also checking your blood pressure at home. You can have a self-monitoring of blood pressure, and so that also needs to be very correctly controlled. So I hand over to Dr. Rajesh now.
So there are some very interesting things coming up. Now we are hearing about COVID and how to prevent. Here's my question to Dr. Amrish Mittal. Some people are saying that sitting in sun may protect against COVID-19. Is it true, sir? What's your opinion about that?
Okay, among the many factors that are thought to possibly protect against COVID is an adequate vitamin D status. It's not something that is absolutely proven, but definitely severe D deficiency levels of below 10 nanogram do increase the risk in general of respiratory virus infections and also compromise the outcomes. So in general, it's common sense right now that you try and maintain your D level at normal. Like at least not in a deficient range. And there is observational data suggesting that people with lower D levels have poorer outcomes, but then, you know, it's not intervention and it's not randomized control, but nevertheless, there's an indication there. So therefore, sitting in the sun in any case is good for you. And if you're working from home and if you can do that, then why not? You absolutely should sit in the sun, number one. Number two, you should realize that in our own study, which is not yet done, is that a significant proportion, at least 25-30% of people who are getting hospitalized are coming with levels of below 10, even now. So that is not okay. So if you get enough sunlight exposure, try and eat fortified, consume fortified milk and food if possible. And if necessary, take low dose vitamin D supplementation to make sure that your levels are okay. In general, vitamin D has a role in building immunity, and it has a role possibly in reducing the severeness of the COVID storm if it happens. So vitamin D is the link between sunlight and COVID. It is via vitamin D.
I just linked this vitamin D story with the nutrition story. Dr. Rajesh, you don't mind if I speak in between?
No, sure, sir, sure. The next question was to you only.
That will answer a lot of your questions, because I think there's a lot of questions which are related to diet. And vitamin D is not exactly diet, as Dr. Amrish has said. Now, there are two components that must be maintained very well in diet. And one of the component which is low as far as Indians are concerned, and because of course we are a vegetarian, most of us are vegetarians, is protein. Protein intake is low in India, and protein is needed more in Indian population for many other reasons. But as far as the immunity is concerned, any low albumin level in the body, which means low nutritional status, actually leads to immune dysfunction, because all these cells which are fighting the COVID are made of protein, and the whole immune system actually is made of protein, whether you talk of antibodies or you talk of cells. So adequate protein intake is important in this. Now, the moment patient is admitted in the hospital, because of nausea, vomiting, decreased appetite, and major stress on the liver, which makes the protein levels goes down like this, totally dives. And so more protein supplementation, oral supplementation, and sometimes intravenous alimentation is required during the COVID-19 illness. But that's a doctor's job. That's not a patient's job. The patient job is to have a good protein. Egg and dal and soya bean are these are the usual types of protein, paneer, etc. And those who can eat fish and chicken, they are good sources of protein. Now that is one. Now, many people have been saying about other things like zinc, vitamin A, the vitamin C, and selenium. There are 4 or 5 things which are being talked about. And zinc and selenium have been shown previously to decrease infection, mostly in children. So is vitamin C. Some amount of upper respiratory infection was shown. None have been tried in COVID-19. But taken the premise from the previous studies, everybody thinks that they may be protective. Well, I can't say no to that, but I can't say yes to that also. But if you take these in diet or otherwise, I say, okay, go on, because they're not going to do any harm. There are a number of things in the diet which can provide you zinc, and some of the things can provide you selenium. This is not the forum. I can talk on all those issues, but you can contact your nutritionist and have a proper diet. Now, proper diet as far as WHO is concerned, now currently is 8 to 9 servings of vegetables and fruit. Now, previously it was 5 servings. Now it has become 8 to 9. That is what WHO says in current. So fruit, vegetables, nuts, seeds, protein. If you have this, you are covering most of the deficiencies and most of the vitamins. There's a specific question, Dr. Rajesh, I will answer on nutrition, or Amrish can answer, or anybody can.
Yeah. Rajesh, I just wanted to add again, carrying on from the WHO recommendation in 2020, just about 3 months ago, micronutrient supplementation has been considered a must for the pregnant women. That's the most recent guideline. And we are working with the government for the portion initiative and with the UNICEF as well. So pre-pregnancy, in pregnancy, beyond pregnancy, all of these vitamin C, D, selenium, zinc, etc. It's in a chain of the micronutrients along with protein. Nutrition first. That has been very much emphasized in the recent past, and COVID has only catalyzed this movement even further, because everybody themselves also want to recognize the importance of these things. So it is our best moment to encash, tell everybody that these are the need of the hour for a long time in your life.
This is actually a very burning question and very important. Everyone wants to know what should they eat. Just in few words, sir, each one of you, could you please mention that yes, you eat this in larger quantity, or you try to avoid this, because people understand that much better than the name of the elements and the micro elements. Can you just, Dr. Anubisha, would you start? Few words, key. You have this.
Okay, what I'll do is I will divide the meals of the day into three to four meals, and I'll tell what each very quickly. Say breakfast. You must have milk. Milk is good as far as dairy is concerned. You have if you are eating egg, please have egg. You have one fruit and have some oats or dalia or something like that, or chila. And if you want to have some nuts along with this, that will be good. Nuts, maybe almonds, pistachios, or walnuts. There are seeds like the chia seeds and others, which can give fiber also, which are good for heart also. So you can have extra grounded seeds there. If you are taking the lunch, chapatis are fine. You can put extra grain into it. Do not leave chapati. Do not go into any fat diet. That's another thing that I wanted to say, that don't go into intermittent fasting, and don't go to keto diet or something. extra dal, extra dahi. Dahi is pretty good. I'm sure Amrish will recommend that for bones also. And green leafy vegetables along with salad. So now you have, at least by this time lunch, you have covered 3 to 4 servings of vegetables and fruits, and protein you have. Now, if you cook some soya bean, you can cook some Nutri-Nuggets, or you can have some fish and chicken. Meat is also allowed, but this will give you a good amount of protein. And dinner in the similar manner. In between, have a snack of either protein or paneer sandwich or something, along with some nuts, and you can take another a little bit of nuts in the night time. So this is a usual balanced meal: 3 to 4 servings of fruit, 3 to 4 servings of vegetables. Green leafy vegetables will be fine, and plenty of nuts and the seeds, and this gives you a good amount of fiber and all the micronutrients which Dr. Hema was talking about.
So,
Dr.
point, Rajesh, I think this is excellent. I mean, if people could just understand this, COVID or no COVID, much of our job is done actually. So
Yes,
I
yes.
think what Dr. Mishra has explained wonderfully is a healthy, balanced diet. It does not change during COVID. The only thing is he made a point which is very relevant, and that is about fad diets. Firstly, we generally try to avoid, but at least at this point, don't experiment. When things are back to normal, you can go back to your doctor and discuss which, if at all, you can try any kind of new diets. At this point, sticking to the basics in nutrition, sticking to what Dr. Mishra has so clearly explained in terms of actual food items, I think that is very important. Going in for crash diets or doing something crazy at this stage is certainly not acceptable and not advisable. So the basics remain the same: higher protein, lower refined carbohydrates, lower trans fats, more of fruits, vegetables, berries, legumes. Even legume and our dals and all are also pretty good
Right.
sources of protein. So that's the way it is.
Rajesh, what we do
Dr.
in the
Hema,
women's
I would
space
request.
can I just interrupt, because it's an important point I want to place on records. First, we find out from the women what they're normally eating, because she is the one who caters to the whole family's diet. So depending on that checklist, because the cuisine is so different in different cultures and communities in our diverse country. So first we have to find out what is it that they're normally eating at home, and each of the meal, what is right, what is not right, and what they have to add and what they have to delete from there. It's the most practical way of telling them, because even if you broadly say either on carbohydrates, proteins, or you say on all these foodstuffs, it's so diverse and so different in each of the families, and it's important to empower the women, have that knowledge so that the whole family can eat healthy. So this is what I want to place on record.
Hema,
And many
like
dietitians in the country are actually finding recipes and put on the YouTube for families to take on. So they must pay attention and follow it to do their best for their own selves and their families.
Dr. Hema, from your experience, any special advice about any particular food intake? What I want to hear from, and it's not that just me, it's all the audience wants to hear, is what to eat. And especially in your perspective, that you're seeing a lot of pregnant ladies, women, and a lot of GDMs or pre-existing diabetic females who are also living in this COVID era. So can you give some specific advice ki ye khana hai, ye nahi khana hai, this is good, this is bad?
Okay, the context of what I broadly said, coming to the specifics of those who have recorded high blood sugar in their pregnancies, which we call as GDM or gestational diabetes or diabetes in pregnancy, for them, two important things. One is frequency of eating. Every 2 hours,
Yes.
little bit, and the portions that they eat. They cannot eat 6
Yes.
idlis at a time. They have to do 3. So the portion size and the frequency are the two important driving things that we tell them. And when we say carbohydrates, we cannot just tell carbohydrates, as you have rightly said. We have to say which of those food stuff that they eat and get immediately the sugars high. Those are the things that they have to avoid. So cakes and pastries and frank sweets are a definite no-no. And then we tell them about the signal system. For example, fresh fruit is in the green, but canned fruit juice is in the red. They can't have that. That's the difference between that. Rice, brown rice is green, white rice is in the amber, and biryani is in the red. So it's just saying rice is not enough. How it's cooked, how it's made, how it is be given. And nuts and seeds, very, very important. And the proportions of, we explain to them the plate concept. In the plate, if you divide it into 4 sections, 1/4 with vegetables, 1/4 with fruits, 1/4 with pulse, and the last quarter with either rotis or rice. That is the carbohydrate part of it. And it is, some kind of a proportion that they can relate to and understand. So there's a lot of dialogues that we have to do. And now in the digital era, we started making small snippets of these 1 or 2 minutes video bites and just sending them by WhatsApp and putting it on our Health for Her YouTube channels, for example. Because we have to reach out to as many, because each of the consultants doesn't have the time or the appropriate knowledge of a practical way of telling them. That we must admit. But there are no luxury of dietitians or counselors in all the setups. Gali mein, if you want to say, you have to do the methodology of each one. That is the only way.
Yes, exactly. Thank you so much, Dr. Hema.
Dr. Rajesh, I'll just make a point here, just one point, and that is related to diet and COVID-19. And Ambrish may comment on that if you want. 3 things have been shown to decrease enzyme. One enzyme, which is important for attachment of virus to the body, and that is angiotensin converting enzyme 2, ACE2. And what are those dietary things? Cabbage. Cabbage is something which decreases ACE-related activity, and broccoli, extract of broccoli also. And third is egg, and also some dairy products. So that's why in my, the whole day long menu, I had included all this except broccoli, because not everybody can afford that, or it's not very easy to get and things like that. But these are actually directed towards preventing access of virus to the body. So they are specific. In general, they are good and specific to COVID-19. How much they will do that, I don't know. But they have been tried and tested as far as that is concerned.
Thank you so much, sir. There's one more thing which interests everyone, and it is not only about diabetics, as you were mentioning earlier, it is about hypertensive patients with chronic diseases. Because of the lockdown and because of the restricted mobility, they literally are not able to go out for walks, to gyms, to exercise. So this question I would throw to each of the panelists. Please give some of your advice, recommendations on how to be active and how to do some physical exercises, or some of your anecdotes or some of your recommendations. We'll start with Dr. Amrish Mittal.
So I think, remember that in Delhi, it's either too hot, or it's too cold, or it's raining. So in any case, you need to have a method by which you can exercise at home, right? So regardless of COVID. So it is just the feeling that you can't go out that restricts people. Otherwise, there are so many things. People who perform yoga and deep breathing is amazing. Breathing exercises in yoga are very important, specifically for COVID, because they will keep your lungs expanded, and the lungs are healthier. The virus will have less impact on the lungs. So definitely yoga is highly recommended during this phase. If you're not the yoga kind and you may not like a particular kind of exercise, then there are so many options. I mean, if you have an instructor kind of model, your instructor will happily do it on WhatsApp with you, video. If you are following a group, then there are so many YouTube channels now that will advise. There are so many apps. There are dedicated apps just to help you exercise at home. So there really is no reason for someone like me or even Anup. I know we love walking. So, you can walk if it's an open area. If it's an open area, there is no reason to feel so restricted. If you're living in an area where a walk is not possible, it's different. But if you have something at the back, and Delhi, there are many spaces, talking of Delhi, many spaces, open spaces behind accommodation, behind residential areas. And you can definitely go for a walk. Don't go at a crowded time. If it's a social kind of scene, avoid it. But if you're going just for a walk and another half a dozen people walking who are 15, 20 feet away from you, there is no problem. Personally, I wear a mask even while I go for a walk. I do not like to walk without a mask. As I said, my mask protects you, your mask protects me. But unfortunately, I don't see that, at least 50% of people are either not wearing a mask or not wearing it properly. I can understand if you're into very serious exercise like cycling or very intense jogging, that a mask may feel a little suffocating. But other than that, I see no reason why people should not go for walks in open spaces. Spread of virus through open spaces is not common. Wear a mask for double protection, and definitely that is one thing. And as I said, indoor exercises, there is no problem. And activity within your house or within your workspace, just stop using all elevators or lifts. Walk up and down the stairs wherever you can. Go to the terrace 10 times a day. Even those little things add up. So I think it's entirely possible to maintain a good level of activity.
I'll just add to that what Amrish has said. People used to say that television and laptop actually promotes obesity. I think if you use it properly, they will decrease your weight. And currently, there are so many YouTube videos which will tell you on the spot exercise. And one of the very common ones is stepping exercise, 1, 2, 3 back, 1, 2, 3 back. Very good videos. They are all available for free. So I would say, please use your TV or laptop to have songs and these videos play to you, and you can do 15 minutes or 20 minutes on these itself. Plus, women often they may have been trained for dancing or something, or rope, so they can do ropes at home, dancing, aerobics at home, and also I advise that everybody should do a little bit of weights. Weights are important, and if you don't have weights, you don't have to go and buy them. You just have a 1 liter bottle on each hand, which is 1 kg, and please do weights for 15 minutes in every direction. I think those are the exercises which will improve your circulation. And remember, as Amrish has said, any kind of exercise is good, but exercise, why is it good? Apart from increasing the respiratory fitness, it increases the T cells immediately. First, one bout of exercise and your immunity is double. I don't think there is anything which can improve immunity in shortest period of time like exercise. So one bout of exercise and your immunity is up, but it goes down. So you have to do repeated. 24 hours is the time. Don't miss after, if you miss a 24 hours bout of exercise after 24 hours, then your previous exercise, whatever benefits are, they've gone down. So people say, well, doc, I do 2 days in 7 days, 1 hour, and is that enough? I said, no, that is not good. 7 days, half an hour of exercise every day. Do not miss your exercise. You can miss one maybe, but do not miss the exercise. So indoor, outdoor, as Amrish has said, both combined together, this combination is good. And right now, the outdoor air is so good. And Amrish sends me a lot of picture of nature. He's a nature. It's good, so there are flowers outside, there's greenery outside, and the pollution level is less. Please do exercise outside.
So I think that again, Anup, is a great point, and it deserves validation. Sorry, 1 second, Hema. Is that the role of exercise and immunity?
Yes.
When people ask for all kinds of concoctions for immunity, I always say, if you just do 30 minutes a day, you're improving immunity the best. But somehow it doesn't connect in people's minds that exercise and immunity are so important. Sorry, Hema, go ahead.
No problem, Amrish. Again, coming to the practicality in our, practice, we find that pregnancy is the most, the moment which we can encash, because they will do whatever we say. So the pregnancy and yoga we've introduced last 10 years, and then, they are on the group yoga classes and all, which they love. And then once they get initiated into that, it is our job to keep them motivated to do it for ever and forever. So that is one start point, which, since a decade, that has proven very, very effective to implement as a lifestyle change. And also we tell all the mothers that their daughters especially should be in any form of something that they love to do, like aerobics or Zumba or swimming or any sports. You have to encourage them from that age, which is the adolescent age, which has to then convert into their lifestyle habit. Because suddenly we are telling the premenopausal, postmenopausal women at 40 that now you start exercising. It doesn't become a way of life in reality. So adolescent and pregnancy are the two target for the generation next. We have to invest our energies with conviction that yes, this has to translate into really their own selves wanting to be doing this in their lives for all time. So that is, that's how our approach has been.
Thank you so much. Dr. Anup Mishra, there's a question, there's a query about by people that because of the severe COVID infection, the pancreas are destroyed. Is it true that COVID infection can induce diabetes?
That's very interesting question that you've asked, because and this we knew a little from the previous coronavirus. This is not the first coronavirus. There have been other coronaviruses also, and there was a hidden sort of a literature there which not everybody read. Is that in one study in 2010, the previous coronavirus, those people who were infected, 17% of those had some amount of pancreatic damage. Why is it so? Very interesting again, is that this receptor which I talked about, ACE2 receptor, through which coronavirus takes hold of the body, is more in pancreas than lungs. So lungs is a target, but pancreas is another target. So, but we do not know how much damage it can produce. But one thing is sure, that it seems that many patients who have developed very severe diabetes during coronavirus infection and have developed an extreme condition called ketoacidosis also possibly had a major pancreatic damage. They didn't have diabetes previously. So there are two types of diabetes which are occurring now. One is due to which are hidden diabetes. The patient was anyway going to develop diabetes, and due to stress and steroids and infection, he developed diabetes. The second thing is coronavirus is selectively destroying pancreas, and that produces less doses of levels of insulin, and the sugar goes up. So now how many people have this kind of diabetes? We do not know, and how much damage it will subsequently will exist or it will repair itself. We also do not know. So we don't know natural history of this type of diabetes, but this is something which we are, so all of us, Amrish also, are collecting some data, we're looking at things and characterizing it, and we'll be wiser in a short period of time.
Since we are at it, sir, we're talking a lot about ACE and about ACE2. So, Dr. Amrish Mittal, a question to you. There's been a lot of controversy about using ACE inhibitors or ACE blockers, commonly called ramipril, telmisartan, olmesartan. And there are other controversies also because there's some of them mention that the ACE2 can be beneficial because of the rise in the ACE2 levels, soluble ACE2 levels. The others say that the spike protein, which is being blocked, the number of spike protein is increasing, so ACE2 should not be, and ibuprofen should not be utilized. So what is your opinion about that, sir? What would you suggest and recommend?
So I think this is an important question, but I will not go into the detail because detail is all speculation. I will give you a one-line conclusion. Do not stop your ACE inhibitors or ARBs if you're on that. We don't know at the moment if they increase your risk or reduce your risk. At the moment, the evidence is to control blood pressure well. And if your BP is well controlled with ACE or ARB, the prils or the sartans, please continue that. Don't be scared of that. There is no evidence, no recommendation at the moment in the clinical setting to say you should reduce them or you should stop them, anything like that. So continue BP medicine, control it well. That is important.
Dr. Anup Mishra, Dr. Amrish used a very, I would say, interesting word, scared. So what we are seeing in this COVID era and the lockdown is that people are actually scared. They are very much scared. That is causing a lot of anxiety and maybe depression, subclinical depression or real depression. They're scared of the future. They don't know what is going to happen. So, sir, what is your advice to our diabetic patients, chronic disease patients? What would you advise them, and what is your take on this?
That is something which is, as you rightly said, is very, very common. In one of the studies that we published on this, 87% of the diabetic patients responded by saying they either had anxiety or depression, and most of them had troubled sleep, and many of them had nightmares. So this is something which this has a natural history now. Now, when it started, it was little. Uh, 2 months later, when we did not know so much about this and how many deaths it is causing, and everywhere there was a lot of fear and psychosis, then it was at the top. Maybe 87% was 2 months back. And recently, this fear is gone down because we have seen that in city like Delhi, the things have stabilized, maybe going down, and hospitals are reporting lesser number of deaths. So all this media is acting, the fear psychosis, fear of unknown, everything is acting. Now, this poses the major challenges to us, all of us, because we are not exactly a psychiatrist, but the patients have faith in us. So in teleconsultation or otherwise, first thing is to actually speak positively and reassure the patient that if you are well controlled, if you are doing everything that we are saying, then it is highly unlikely that you will get COVID-19. But at the same time, perhaps you have to take more precautions, as Amrish had earlier said, than many other people. And that itself, one or two sentences like this reassures them like anything. Many of them actually, despite fear of COVID, they come to me and come to me face to face and start crying here in the office.
Yeah.
And
Yeah.
I just have to speak a few minutes reassuring them, and they are mostly fine. So we are doing a job of a psychiatrist at this point of time, but some patients will not respond and they get into deep depression where I'm sure all of us have to take help of a trained psychiatrist at this point of time.
So in fact, Anup,
there's
this is a pressing problem, Rajesh. This is a serious problem. In fact, everyone starts exactly the way Dr. Mishra said, with anxiety, neem nahi aati, घबराहट होती है. Those guys. So it's not just you're worried about your health, is the fear of uncertainty. It's also your work has gone, people's business is gone. They just don't know what to do. So the whole thing is significant, and we will need a lot of care post-COVID for the residual mental impact it could have on populations and the productivity. So I think that's a very, very relevant point, and we really need to pay attention. People are already paying attention actually to that. So I can't.
Yes, Dr. Hima, you wanted to add on something.
Yeah, because add to what the Padma Bhushans and Padma Shri on the show has said, we would think that the pregnancy hormones and its fluctuations, as it is, creating a havoc in the women's body. And then there is a lot, many times where we as specialists tend to ignore this, even in the non-COVID era. Anxiety in the antenatal pregnant period, for example, or postpartum depression, somehow because we don't have the great expertise in that, it's a tendency to push it under the carpet or ignore it. Now we have definitely recognized, just as how we've recognized nutrition, the connect between the immunity, lifestyle, etc., people are also paying attention to that. Similarly, these mood disturbances, which are already inherent in a pregnant state, are topped up with the anxiety. Many of them have a feeling of regret that they became pregnant in the wrong time, so that is a very difficult kind of mindset to deal with. And all the time we're not able to give them the correct information. What will ensue, because we don't have that kind of information of what COVID can do in pregnancy as yet. Only the care at delivery and the testing at delivery as mandated by CMR we are doing. So luckily we have found most of them asymptomatic. Most of them have get away with good outcomes. Complications by far are for other reasons rather than anything to do with COVID. So in general, it seems to be a positive thing because of their age perhaps and less comorbidities. They're doing pretty well. The tensions are always there because they don't have answers to any questions that they ask at the moment.
Dr. Rajneesh, with your permission, one small question related to this only. See, man is a social animal. So these diabetes patients also, before COVID-19, were socially meeting their friends. Now, suddenly, they are totally isolated, and there is a desire to go and meet their friends.
Yes, very well.
So, that interaction is being expected by people. So, would you recommend that they should go on one-to-one, meet their friends, or they should totally remain secluded?
Sir, the comment is very, very appropriate. This kind of thing to socialize is something which is like alcohol, sir. If you are forced to leave it, you will come back to it. And I can tell you, yesterday only, I got to know that two of my colleagues who are very well-known doctors and all knowledgeable. They know what to do, certainly, still social and got COVID-19. So, sir, we can do up this much, but not everything. But at the same time, we don't have to isolate a patient and say, well, you're on solitary confinement. No, we say, yes, if the other family you're visiting sometimes, but that's not going to be very frequently, is also isolating and taking most of the precautions. Once you meet, then you are there wearing mask and you're wearing mask, then a short meeting is certainly, which is something which is allowed. People are doing much more than that, sir, at this point of time. But for diabetic patients, we can, at this point of time, at least in Delhi, when the positivity rate is less than 10%, and so it is highly unlikely that a person you're meeting who's also knowledgeable is going to be positive asymptomatic. It may be, but it is unlikely. So if you take all precautions, keep your meeting short, keep it once in 7 days or 10 days, then you can start a little bit of socializing, but that doesn't mean, in India, there's nothing like a little bit, sir. If you say once in 10 days, then it'll be a 10 out of 10 days. So that is the problem. The attitude and mindset is the problem. So we are not disciplined in that manner. So if somebody is disciplined, you can allow. If somebody is totally indisciplined, then say, well, stay put.
I would like to
tell you.
ask a few short questions. Okay, I'm sorry I interrupted, sir.
No, I was saying even doctors are facing this challenge. Doctors are social people, and there's a big challenge there. And if you put everyone just on video consults, I mean, you're used to meeting your patients. I mean, that's your tonic. And you suddenly don't meet anybody, you do everything on this. It's very taxing and it's very draining. It can definitely affect you. So you need that feedback of humans, but it has to be. We have to be very, very cautious. Observe all the rules, and then it's okay.
So since we are running out of time, there's some very specific questions about diabetes which I would like, which I'm sure everyone wants to hear about, and which there can be no authority better than the ones which are right now in front of us. One, Dr. Amrish Mittal, we know that insulin itself is an immune modulator, and it is good. It is given in all the infections. So, what is your take on giving insulin to every person, every diabetic now adding insulin? What would you suggest?
No, I think the consensus on diabetes management is to have good control. If you're talking of somebody who's not infected or who's asymptomatic or even in the mild zone, I don't think if the person is well controlled, there is no reason to make any change. And if you can make a change a little bit in the orals to improve control, that's also all right. So insulin is not mandatory. However, having said that, moderate and especially severe COVID patients sometimes show a dramatic increase in blood sugar, even without steroids, even without glucocorticoids. And especially the severe ones, that is the norm. If COVID or no COVID, you have to control their diabetes well. It has a huge impact on outcomes. Then you will obviously need insulin. You will need either intravenous insulin or you will need what is called multiple shots of insulin. We call it basal bolus regimens. But you will need insulin for the severe cases, no question about it. For the most severe, you will need intravenous insulin. For those who are in the moderate zone, if they are not well controlled with orals, you may want to add insulin. But adding insulin with the belief that insulin alone is going to do something and that orals are harming you is not required. So if someone is well controlled in mild to, especially asymptomatic mild, you can leave them alone. But the moment you are hospitalized and move ahead, then insulin becomes very important.
I'll just
Yes, sir.
make a point in second, Dr. Mittal, is that I personally think, and that's for me, for general, for every patient, is that some of the old drugs are very, very good.
Yeah.
And one of the
Metformin.
drug which is, one of that's exactly what he's taken the words away from my mouth. One of the drug which is the time-tested drug, the frontline drug, metformin, is the only drug amongst the diabetes drugs which has been shown by some studies. They're not exactly the gold standard studies, but some studies to decrease death more than many other drugs, chloroquine and this and that, all those things. So I would say, if we are managing with a small dose of metformin, in such cases when there is a uncontrolled sugar, we increase dose of metformin instead of using insulin. Insulin in those patients where Dr. Mittal has already said that it is then beyond the range of metformin, beyond the cover of all these oral drugs, then we have to use it.
So I would like to add one question here to you. So we know that the complications of COVID is related to clotting, microclotting, and further on. So is it would it be logical, or would it be beneficial to add aspirin to all our diabetic patients?
I think that's a very good question, and some of the patients have also asked, because we are not using aspirin in every patient. In those patients who have already had a heart disease with diabetes and they are very, very high risk, then we use aspirin. Aspirin has its own dangers also. That's why we are not using as much as earlier. Now, this if we use aspirin in say 100 diabetic patients, all of them, and only 5 of them get COVID, then we are wasting aspirin in 95% of the people. And that's exactly what is happening as far as Delhi is concerned. Possibly 5% of the people will get affected in 100 diabetics. So, and that may cause problems. So no, that is not warranted that all patients of diabetes without COVID-19 should be on aspirin. But as soon as they get COVID-19, they have to be on anticoagulant. There is no question about it. And those anticoagulants may be, starting from antiplatelet like aspirin to a heparin, low molecular weight heparin, and others, which are going to prevent thrombotic microangiopathy in the lungs and also thrombosis in the vein. So that is my answer to your question.
Rajeshji, I just wanted to also add, when it comes to the use of insulin for pregnancy and diabetes, I would once again urge every woman who is in the audience that as per the professional organization guidelines and the Government of India recommendations also, that all pregnancies in India will have to be tested to check their sugars at once a third month and 6 months. What is happening today is, because this is not being done, they very late, and already the sugars have gone sky high, and we have no option but to use insulin. So give us a chance to have better control. As Ambrish ji said, focus on the targets. As long as you're under control, either with diet and exercise or with women, we're happy with that, and we want to keep the insulin usage to the minimal possible in the pregnant population, because it really adds to another trauma of the daily monitoring and the fluctuations that happen in pregnancy. So early testing and detection, and getting around to controlling it with simpler means rather than insulin, because as how it has been said, even in the COVID era, there's no need to shift from the types of medications that you've used for control to the insulin. That has been very well clarified. So you should pay attention to having the tests done, and your health is in your hands.
I'll just make a point here, Rajesh, is about, and that is going into another territory, and that's Dr. Hema's territory, which Dr. Hema, I'm sure somewhere there down the line may have told people or going to tell here, is that during pregnancy, if we are going to diagnose gestational diabetes, we are not at this point of time going to do oral glucose tolerance test. That is when you go to the lab, you get an intravenous sugar done, and then glucose is given, and then we are going to rely on the glucose meter reading to decrease contact between a pregnant woman and the lab people.
Sure.
So I'm sure this is what Dr. Hema would have said. This is what is needed at this point of time. The moment this goes down, we'll go back to the proper oral glucose tolerance test. At home also, patient can take glucose and do the glucometer monitor.
So there's a lot happening on the digital space and the diabetic care of the pregnant women with the daily connects, which is so crucial for the timely instructions and the monitoring, which again makes the face-to-face interface and her visits to the minimum. So this is a very crucial point. Thank you, Dr. Anu.
Dr. Kesari?
I think Dr.
So
Kesari is frozen in time.
Yes. No, I've come back again. There was some problem with the audio. So one question, should all COVID patients, all diabetics be tested for COVID? This is also very important because people keep on asking. Just in short, sir.
Amrish.
No, there's no such guideline. It's not that every diabetic, unless the government develops a population screening policy, I don't think there's any sense in every diabetic being tested for COVID asymptomatic, nothing.
Vice versa may be true. Every COVID positive may have to be tested for diabetic because they may not know. Yes.
Dr. Hema, how about breastfeeding of pregnant females if they develop COVID? Should they or should they refrain?
So unless the women is very seriously ill, the first policy is say yes to breastfeeding. And as I said, most of our pregnant women who are COVID positive are also asymptomatic. The same precautions of masking, hand washing, hygiene, etc. should be maintained. And she is allowed to breastfeed, which is the best feeding. We still maintain that. And unnecessary skin-to-skin contact and cuddling of the baby, etc. should not be allowed either by the mother or the relatives. So this is the general policy. We room in and we allow the breastfeeding because this virus is not yet detected in the breast milk. So this has again been re-emphasized to the patient and the family that they need not fear the breastfeeding, which would be in the best interest of immune status development of the baby as well.
First of all, thank you so much, everyone, panelists, that you are here. You spent so much time. At the end, I would request each one of you to say few words, give some advice, maybe in pointers, what our diabetic hypertensive patients should do, what should they avoid, your advice to our listeners and to our patients. Sir, we start with Dr. Amrish Mittal.
Well, I think the advice has been brought out by this seminar very nicely, and basically the same norms that we advise for you in general, just follow those regularly, meticulously to keep yourself safe. The important point I want to make at the end is that even if you do get COVID, overall outcomes are pretty good. So while we are comparing people without diabetes with uncontrolled diabetes, and we share all the data with you, the fact is that most people are doing very well. So there is no reason to be scared. If you do get COVID, despite your efforts, despite your precautions, you still can get it. If you do get, the quality of care has improved drastically, dramatically. Most of our patients are doing very well and are actually being discharged in a reasonably good condition. So do not despair. Don't panic if you're found to be positive for COVID. Even if you're a diabetic, it can be managed.
Dr. Mishra, sir.
Yeah, I usually say the same thing to all my patients. This is the time to change. You know, if you see my practice or Amrish's practice, everybody, there are 70% of the people who are non-compliant to diet, exercise, or drugs for one reason or the other. And around 20 to 30% are taking excessive amount of alcohol or smoking. Now, very interestingly, during this time, many people have less smoking and alcohol because there was no shop open. So I tell them, this is the time. This is the time to change. This is the time to change your lifestyle. Be more disciplined. Leave your excessive alcohol. Leave your smoking. Maintain your sugar well, and decrease the weight by sticking to a broad range of dietary guidelines and broad range of the exercise guidelines. World is changing, and you can also change. I think many patients they appreciate this comment, and they are now saying, "Yes, I want to change."
Thank you so much. Dr. Hema.
I think COVID or no COVID, I would chant the ASSOCHAM mantra with Anil Rajputji, Sandeep Jainji, and Rajesh Kesri and the stalwarts here. That always your mantra should be prevent illness and promote wellness. That's how the title of this very program reads. So pay attention to preventive care. In no other times in our life, we have recognized that health is wealth and prevention is better than cure. So adhere to that in every possible way. Stay ahead of times, stay healthy.
Thank you so much, ma'am. Thank you so much, all the panelists. I would now invite Mr. Anil Rajputji to give a vote of thanks to everyone. Sir.
You're muted.
Thank you very much, Dr. Amrish Mittal, Dr. Anup Mishra, Dr. Hema Divakar, Dr. Rajneesh Kesri. It's been a very, very engaging, insightful, delightful interaction, and I'm sure all the participants are enriched with your experience, with your advice, and going forward, we would be able to, as India, uh, be able to fight this COVID-19 pandemic very well. So far, I think India is doing exceedingly well, and with the efforts of all the healthcare workers in the country, and especially people like you, who are coming and giving advice to the people and spending time with them, giving them assurance that the things are not as bad. You know, this fear of COVID-19 has to go, and people have to be mentally strong to deal with this crisis so that we conquer and happy days come back to our lives once again. Thank you very much once again to all of you. Thank you.
Namaskar. Thank you.
Thank you so much. Thank you.
Thank you.
Thank you.
Thank you.